Can flat feet cause pelvic floor dysfunction? The answer is yes. So most people think about pelvic floor dysfunction as incontinence, and I need to clarify that pelvic floor dysfunction is instability of the pelvis with many presentations. Incontinence may be one of the ways, but not necessarily. So now, let's talk about the feet and pelvic floor dysfunction. When you're standing on your feet, this joint right here is looking at the structures above, which is your whole body, and it is trying to really grab as much information from all these structures above and then translate that information into your forefeet for balancing. So when the arch is collapsed downward, forget about the reason why it's collapsed, because that's a whole different video. But I can tell you that if you are hypermobile, when you stand up, the connective tissue that's connecting all of these bones is lax. So it's very easy for it to drop and you have flat feet. Just put that piece of information aside and let's talk about the flat feet. The moment flat feet, the flat arches take place, so either it's at standing only or you just have flat feet. Every piece of the structure above the subtalar joint, everything above, has to adjust its presence based on what this area is not able to perform. That means that we're altering the positioning and functionality, not for a moment, but for more of a permanent presentation. When that happens, the lower extremities do not perform at a level that they would otherwise be, and that directly impacts the connection of the lower extremities to the hip sockets. Right here, the hip socket is provided by the pelvis. So now you have things attached to your pelvis that are now not providing equal balanced positioning. Now your pelvis could be, your body has to adjust its position based on whatever else is not happening. And that instability in the neutral pelvis, that instability in the functionality of your pelvis impacts everything, its stability. And when it comes to the floor muscles, I need to bring to your attention that the floor is not living by itself. It is connected to the walls inside the pelvis, and the inside of your pelvis with the outside of the pelvis provide double layering reinforcement for a stronger pelvis. When that is compromised, when the pelvic positioning and stability is compromised, we end up with issues with the muscles of the floor and more. So there is a direct correlation, just as what's happening above the feet at the subtalar joint impacts the performance of your forefoot. What's not happening as a result of, let's say, flat feet, which a lot of times could be hereditary, impacts the positioning of everything above. So finally, I want to remind you that when it comes to treatment for pelvic floor dysfunction, in today's world, majority of time we go through the anus and or vagina to try to have access to the inside. And to me, it just does not make sense, because it doesn't answer the why behind why that muscle is tight or it's weak. So by going there to address or practice contraction or practice relaxation of the inside muscles, we're not really addressing the cause. So That's another video that I have done. We'll make sure that we put that video at the end of this one, so you're more than welcome to watch it. I invite you to use your common sense when it comes to your health. And you gotta not avoid understanding how your body moves. And I'm not asking you to become like the expert in body mechanics and anatomy and physiology. I'm telling you to take the time to understand and invest in understanding the basic foundation of movement, the principles of movement and functionality of your body. Just as when you drove, when you started driving, you invested in understanding the rules of driving and exhibited the knowledge of knowing how to drive the car. So the fix sometimes with flat feet is orthotics, but it doesn't have to always be, because once again, these don't just collapse, but it's a function or lack of function of the leg muscles in charge of this and the feet muscles that can lead to that collapse of the arch. That's a whole different video and something else that we at our clinic address when it comes to the treatment of pelvic floor dysfunction. From your head to your toe, everything impacts every part of your body. So when we chase after the why, we discover a lot more hidden things that definitely contribute. And that's the reason why our treatments for pelvic floor dysfunction and more is as successful as it is. Thank you for watching. I hope you subscribe to the channel, and I am available for any questions that you may have using one of the methods of contact in the description box. Until next time, take care.